This lecture is about infection control and safety issues that an OT practitioner can run into when on the job. The objective for this lecture is the student will demonstrate sound judgment in regard to safety of self and others in laboratory scenarios and activities. Patients are having shorter stays in the hospital and rehab facilities. Because of this, the OT practitioners are seeing patients who are more seriously ill and coming home sooner. The OT practitioner needs to make sure they are following the safety procedures that are part of the policies and procedure manuals that the facilities they work at, because they would be considered legally liable for negligence if the patient is injured because a procedure wasn't followed. The number one safety precaution that every healthcare provider must follow is proper hand washing technique. You will be doing an activity in lab on hand washing. Whenever you are working with a patient in an environment, you must make sure you have adequate space is available and do not transfer in congested areas. Don't be afraid to move the furniture around so you and the patient can be safe. I've done this many times, moved furniture all day long just to make more room for me, the patient, and all the equipment the patient may be connected to. When using the equipment, make sure it is in proper working order before using it on a patient. If the equipment needs fixing, send it to the proper department to get it fixed. Ensure that furniture and equipment are stable before having a patient lean on it. Don't forget to check the floor for clutter also. Move cords, scatter rugs, litter, and wipe up the spills, even if you weren't the one that made the spill. The next safety recommendation is don't leave patients unattended if you feel they are unstable. If you have to use restraints, get the training to apply them correctly. Patients can be Houdinis when it comes to getting out of restraints. Restraints should only be applied if a doctor's order is in the chart. Most facilities are working towards no restraints. When working with a patient, have the treatment area and supplies ready before you work with the patient. This way, you build confidence with the patient by showing them you are prepared for the treatment session. Only properly trained personnel should provide care to the patient. Families can be training to work with the patient on transfers, but they have to first demonstrate to the therapist that they are safe to do so. In healthcare, you may run into hazardous materials or infectious materials. Make sure you follow the procedures for handling them or cleaning them up. Never ever block an emergency exit with equipment. The last safety recommendation is having and knowing where the equipment is in the department you are working in. Learn how to use a fire extinguisher. All patients are at risk for contractures or bed sores. Some specific patients' conditions, they may have impaired sensation, paralysis, poor skin integrity, poor nutrition, impaired circulation, and spasticity require special attention. Bony areas, those can redden within 30 minutes and you'll have a bed sore. Lower extremity, above knee amputations, you want to avoid hip flexion and abduction to reduce contractures. Bilateral knee amputation or below knee amputation, avoid hip and knee flexion. Of course, that's for contractures also. And frequently do active or passive range of motion exercises with the patient or to teach the patient or family to do those exercises when you're not available. The next few slides, I'm going to discuss some precautions with special equipment that is important. Always check with the nursing staff for bedside patients you're working with for any equipment that the patient may be using. Make sure you know how to use the hospital beds in the facility. Some have standard manual hospital beds. Some have electric operated beds. Always use good body mechanics when working with a patient. Adjust the bed to the proper heights. Use the side rails appropriately. And if you look at the picture here, this is a picture of a striker frame, and the air beds are considered maybe called clinitron beds. Precautions and special equipment. Some patients you may work with may be on ventilators. A ventilator moves gas or air into the patient's lung and used to maintain adequate air exchange. An endotracheal tube or ET tube, the patient's intubated, which prevents talking, reduces tolerance for activities. If a patient is on a ventilator in the facility you are in, make sure you ask nursing if it's okay to work with the patient. If the facility has respiratory therapy available, you may want to call them in while you are doing your session, just as a precautionary measure. Always, always, always know where the tube is at all times to make sure you don't dislodge the tube. In the hospital, many times patients are hooked up to the monitors to watch the patient's vital signs or respiratory distress. You can treat the patient but avoid disruption of the lines if possible. If the line disconnects, many times they attach to a pad, which is just a snap. Snap the cord back onto the pad, which is very easy to do. If the pad looks worn, see if nursing can just change the pad out. Some patients may have pulmonary artery catheters, which is directly inserted into the patient's jugular vein or femoral vein. Again, always know where this line is so you don't pull it out. Some feeding devices are an NG tube. This is a nasogastric tube which goes through the nose down into the stomach. This may cause increased gag reflex. No fluids or food through the mouth when somebody has an NG tube in. They will feed them through the NG tube, which goes directly to the stomach. A gastric tube, which is the picture that's on your screen, is a tube that goes directly to the stomach. If a patient is on an NG tube for a long period of time, they're going to switch it out to an NG tube so it's much more comfortable for the patient. TPN, or total calories or nutrients, intravenous feeding through the vein, which would be connected to an infusion pump of some sort, which administers fluids at a preset rate. An IV line can also be attached to an infusion pump to administer the fluids to a patient. Urine catheters are used to remove urine when the patient is unable to control the retention or release. Urine goes to the collection bag. Females can have indwelling or suprapubic catheters. Males have indwelling, condom caths, or suprapubic catheters. Suprapubic catheters is a catheter that goes directly into the bladder, then outside of the outside of the body. You need to make sure you keep the catheter bag below the level of the bladder as to not have the urine flow back into the bladder and cause urinary tract infection. The photo on this page shows somebody with a leg bag. A leg bag allows the patient to go out in public, have this underneath their pants, and nobody would know they had a catheter. Procedures used to prevent the spread of infections from person to person are universal precautions. These were established by the CDC and monitored by OSHA. Proper hand washing technique, again, is the best way to prevent the spread of infection. Some patients will have isolation precautions. This is designed to protect the person or object from becoming contaminated or infected by pathogens that can't be transmitted. If a patient is in isolation, you will see a cart outside their door. Ask the nurse or check the chart to find out why the patient is in isolation and follow the procedures to protect yourself. Different procedures used you want to check the placard on the door. The procedures that you would probably see in facilities is wearing a gown, a mask, gloves, possibly a face shield, depending on the reason for the isolation. The patient is usually put in a private room or with others with the same disease. Knowing the emergency number in your facility. Some facility it is just call 911, but in many facilities you have to dial a 9 first to get an outside line, so you would need to dial 911. Determine when it's best to ask for emergency care. Ask for help. Always ask for help in an emergency. Just yell down the hall if that's what you have to do. Don't leave patients alone in an emergency. Document incident according to policy. All facilities have an internal incident report that needs to be filled out. Make sure you can get trained on how to fill this out and who you have to report the incident with. Incident to and the chain of command. Don't discuss the incident with others. Do not admit negligence. Just like when you're in a car accident, you never admit negligence. Get the facts first, and then follow the facility's policy to report the incidents. Falls will happen. It usually happens when you're not prepared for them. So always be prepared. One way is always watch your body mechanics. Use a gait belt on a patient while working with them, just in case you need to lower the patient to the floor. If the patient feels like they are falling to the floor, it is best to let them go slowly to the ground, then try to hold them up, and you both get hurt. Some other basic safety and first aid treatment is, for burns, rinse with cool water and cover with a dressing. For bleeding, apply pressure and place a sterile dressing, elevate the wound. For shock, if somebody is going through shock, you want to monitor their blood pressure. They probably will have a fast pulse. They'll become pale. Their skin will be moist and cool to the touch, so you want to cover them with a blanket. If a patient has a seizure, place the patient in a safe position. Do not restrain. Keep their airway open, but do not put anything in their mouth. Insulin. Know that your patient is a diabetic. Follow the dietary orders, especially in OT if you're doing kitchen activities. Choking. If a patient is coughing, just watch them. If they stop making noise, perform the Heimlich if you are trained to do so. For cardiac arrest, keep your CPR current. This is required of all healthcare professionals. Normally you will get the 2-year BLS certification. In summary, following safety procedures and precautions is everyone's responsibility. If you're not sure about something, ask someone who knows, and follow your company's policies and procedures.